Welcome to this series of videos on fertility in cattle, brought to you by livestockdevelopment.co.uk. These videos are for animal health service providers or extension workers, such as AI technicians, NGO and government extension workers, dairy inputs field staff, veterinary paraprofessionals and veterinary surgeons in the field. Their aim is to improve production through improved fertility. Welcome to video 4. This looks at the pharmaceutical interventions for fertility management. There are a number of interventions that may be available from your veterinary surgeon, depending on the local situation. This video describes the generic interventions and tools, but local licensing and regulations may vary. Please consult your veterinary surgeon about the health and fertility of your animals. To understand how these interventions work, we need to understand the cow's reproductive cycle and how progesterone levels change over the 21 days. When progesterone levels drop, the estrogen levels rise and the cow comes into estrus. Whether she is served or not, the progesterone levels rise again after 24 to 48 hours in response to the corpus luteum forming in the ovary. If she is not pregnant, then levels will fall again 18 to 24 days later as she comes back into season. Progesterone releasing intravaginal devices. These come in various shapes and forms: coils, wings, paddles and delta shapes. They are inserted into the vagina where they release progesterone. When they are removed after a week, the drop in progesterone levels mimics the drop in progesterone just before a cow comes into estrus. This drop in progesterone kickstarts the cow into cycling. Cows are served 56 hours after the removal of the device. Prostaglandins, or PG, cause what is called luteolysis. If a cow has a corpus luteum on its ovary, prostaglandins cause it to lyse and disappear. The corpus luteum produces progesterone, so giving prostaglandins causes luteolysis. The progesterone levels fall and the cow comes into season and can be served 72 hours after injection. The corpus luteum also maintains pregnancy, so injecting in early pregnancy with prostaglandins will cause abortion. GnRH, or gonadotrophin releasing hormone, causes the release of another hormone, luteinizing hormone. Along with other hormones, this causes the dominant follicle in the ovary to release the egg and for a corpus luteum to form, and a new wave of follicles to develop. GnRH can therefore be used for cystic ovaries or where cows are coming into season every few days. GnRH is used to stimulate cows with small ovaries that are not cycling to come into season. GnRH can also be used in cows that are not getting pregnant in repeat breeders by giving it at the same time as serving them. Washout for Pyometras. If cows have infections in their uterus after calving, then they will continue to discharge pus from the uterus. The inflammation of the uterus stops the natural release of prostaglandin, and it can stop the cow from coming into estrus. If the cow does come into estrus, then pus may be seen in the mucus discharge from the vulva. This can be treated by giving prostaglandins, by giving intrauterine antibiotics, or by using a special povidone uterine washout. Beyond these simple inductions or synchronizations, there are a number of different programs that are used in different situations to synchronize cows for artificial insemination, combining prostaglandin, GnRH, and intravaginal progesterone releasing devices. For example, A prostaglandin injection 12 to 24 hours prior to removal of a progesterone releasing device may increase conception rates to fixed-time AI. Synch program. The standard Synch program to synchronize cows or to get cows to come into season is as follows. On day 0, GnRH is given to form a new wave of follicles. On day 7, prostaglandin injection is given to lyse any corpus luteum that may be present. On day 9, 48 hours after the prostaglandin, GnRH is injected to cause the dominant follicle to release the egg and form a new corpus luteum. On day 10, 16 to 24 hours later, fixed-time AI is used to serve the cow. This video describes generic interventions and tools, but local licensing and regulations may vary. Please consult your veterinary surgeon about the health and fertility of your animals. Why is my cow not pregnant? That is a question that always needs answered, but in an individual cow is very difficult to answer. Fertility is always about probability, the chance of a cow getting pregnant. Our next video looks at that question.